Hi, everyone. Welcome back to Medical Mondays. For those new here, hi, my name is Jenny. I'm a family medicine physician and a mom of two. And on Medical Mondays, we just talk about all your medically related questions, non-medically related questions, and just answer everything that comes up in our question box here on the side. I know this week is an impromptu, and so no one is here as of yet. So we'll start off by discussing a little bit about what's going on right now in our current state, and maybe some medical topics that we might look into. Like I was thinking of doing a series where we talk about all like different types of medical cases, and some of them that you guys recommended you wanted to learn more about was like low thyroid. What do you do in those instances? What's the diagnosing like, and the whole process? And so I made a list of some of the things that we can talk about, like thyroid, sleep, depression, anxiety, fatigue, anemia, eczema, acne, vaginal health, back pain, IBS, GERD, and lots of different stuff like that. And so I think it'd be a great way to start and help you learn more about like what to look for, like what to ask your doctor about and all that stuff. Because I know there could be a lot of information on the internet. And once you say like looking up like signs of fatigue, the first thing you'll see is like cancer or something like that. And so I want to give you guys more accurate information so you can learn more about your bodies. So yeah, any questions you have, just leave them in the question box and I'll pull them up. So I wanted to talk to you specifically about, before we jump into this, I want to talk to you guys about like do not resuscitate and code status and what this actually means. I know a lot of us are still fairly young and we don't think about this a lot, but I want to talk about this, to talk to our parents about, to our grandparents, aunts, uncles, and all those types of things. Right. Do not resuscitate and code status just means that what you want to do in case of an emergency, what do you want your family members to do for you? So usually the first next line person to make your decisions for you is your spouse. And if you're not married, then usually it's your parents. And if your parents are not allowed to make adequate decision making, then usually it's somebody in your family. And so you have to ask, like, what is it that you want if your heart were to stop? Do you want chest compressions? Do you want to be intubated and have mechanical ventilation? Do you want to have antibiotics? Do you want blood products? If you have to be on a ventilator for over 2 weeks, do you want us to put a tube in your stomach so that you can get nutrition? A lot of these answers are easier if you're able to talk with your family member in a sound mind instead of an emergency type of process. Like Stan and I have sat down and we've talked to each other about like, if this were to happen, we don't want to be in a vegetative state. Do not prolong the inevitable. Do not artificially keep us alive. And so it's really, really important to talk about all those things, because a lot of the times I see families where they feel guilty that they have to make these decisions, even though it's the more compassionate and right choice for the patient. They feel that they are like giving up when it's not actually giving up. It's more of what's more compassionate, right? So please talk to your family about any of these things and just their wishes in general. I do a lot of this during my wellness visit, and I've only been doing it for people like over 65 previously, but I am doing a lot more of it now. So let's do some questions. So let's see. This is a good question. How do you manage your sleep when working overnight? This is super hard for anybody who is doing shift work, like especially switching from days to nights. I know I had the worst sleep schedule when I was working emergency medicine, because they would throw you in like 2 days during morning hours and then switch you after a day to nights. And they don't really care as long as you put in all your shifts. And it was also hard because I had London and Wyatt during those times. And so I wasn't sleeping already in general because I was breastfeeding at night. But I try to sleep when I can. Like usually uh, when I'm working during nights, I will usually the shift work on nights is like 7 p.m. to 7 a.m. And then I would basically sleep when I got home, or after a few hours after I had dinner and stuff like that. And then I would sleep for at least 6 hours, I want to say, and then wake up in my next shift and then go to work again. It's a lot easier if it's consistent. So usually during residency, they'll have at least 2 weeks of night shift. And so start trying to sleep at the same time. And then once you're off and trying to switch back to days, like I try to not sleep and I just try to stay awake the whole time and then sleep that following night. So say you went to your shift at 7 p.m., work your night shift until 7 a.m. I would try to stay awake the whole day and then just sleep early and then wake up in the morning again to restart my day. Hopefully that makes sense. Sometimes melatonin works for night shift or shift wake cycle disturbances. And usually that's 3 milligrams. I know it's harder to find the lower doses now, but lower doses are better. So maybe you can try the kids one where it comes in like a dropper. So let's see. Okay. This other question from Jessica. What are your thoughts on Celexa? Is it normal for it to slow heart rate? Also, is it appropriate to up patients' dose on antidepressants? So I treat a lot of anxiety, depression, and now I've been doing a lot of other psychiatric diagnoses and treatment as well, just because we have such a shortage of psychiatry within our area. And so it really takes like a thorough history to understand like why a person is anxious, or how did this depression start and how long has it started. So Celexa itself is a SSRI, a serotonin reuptake inhibitor. And so it can decrease your heart rate if your heart rate was already fast. Say like you're anxious all the time and you have all this adrenaline, and so your heart normally like beats fast. When you're on an antidepressant and it calms you down, sometimes it can calm your heart rate. There's always a concern that if you have an underlying heart issue where you have like a prolonged QT, let me pull up a normal EKG. It's hard to show actually because I can't really point it out, but you wouldn't really know until you do like an EKG. But sometimes when you have a prolonged EKG or prolonged QT, usually due to other medications than like antibiotics or other psychiatric medications, you are at more risk of having torsades, which is like an irregular heart rhythm that goes fast. So not necessarily slower heart rate. It is appropriate to increase the dose, but I always tell my patients that give it some time, because the antidepressant takes time to build up into your system to truly take effect. So it's not like ibuprofen or something like that where you take it and your pain goes away. It takes time for your body to have a steady state, usually anywhere from a month to 3 months. So if you're seeing some positive effects already at 1 month, I say just continue the same dose. And then at 3 months, reassess how you're doing to see if you need more or not. I always reassess around 6 months and a year. And usually if you don't have depressive episodes, like that 2 weeks of feeling like depressed mood and all those things that contribute to depression, then we can possibly try lowering the dose or discontinuing in general. Don't need to stay on it forever. Okay. Let's see. Oh, I love this. Weight loss. So I've been talking a lot about this in my clinics as well. If you guys have been following me for some time over this past year, I've been really changing my health perspective because I want to live like a happier and healthier life in all aspects, both mental health and physical health. And so patients come into me a lot, very frustrated that they are unable to lose weight. And so I always tell them to start off is that weight loss is hard. It's very hard. And if it was easy, then everybody would be doing it, right? But the basis of it is simple. We just have too much information going on at once. The majority of weight loss, 80% of it is your diet. Okay. And there's no diet that's better than another, not plant-based, not keto, not intermittent fasting, not Atkins, nothing. No diet is better than another specifically for weight loss. There are other health benefits, like for a plant-based diet and Mediterranean diet for cardiovascular health, or intermittent fasting for, say, insulin resistance. But there is no one specific diet that is better than another for weight loss specifically. I know the trend right now is everybody loves keto, everybody loves low carb, but as long as you're in a calorie deficit, you will lose weight over time. There's only very few medical conditions like congestive heart failure that you may not be losing weight if you're in a calorie deficit. There are obviously things that make it a little bit harder, say like if you have low thyroid or PCOS or you're breastfeeding or something like that. Hormone changes causes you to have more of an appetite or appetite stimulant and things like that. So it may be harder for you to stay under your calories that you need, but ultimately with consistency, you will lose weight over time. And understand that calories don't just start over after 24 hours. They're at a continuum. We just note it as 24 hours because it's easier in our minds to calculate it that way. There are obviously other benefits to exercise. The American Heart Association recommends 150 minutes of cardiovascular exercise, anything that increases your heart rate for 150 minutes in a week. So that's about 20 minutes a day to help prevent heart attacks and strokes and dementia. So lots of other benefits to exercise. I found that increasing your body mass, like your muscles, really help with maintaining weight loss. Maintaining functionality, but it's not necessary for weight loss. And I found that walking, just increasing that NEAT, so non-exercise thermogenesis, not NE, non-exercise activity thermogenesis. So how much you burn while not exercising, so in your daily activity in your life, will actually lead to more weight loss than exercising itself. So for me specifically, I found that I lost more weight when I started walking. Like I tried to hit 10,000 steps every day. And so all I did was take Summer on 2 walks a day. And then I had significantly changes in my weight as compared to before where I didn't. And Summer was a lot happier too. So start one thing at a time, start focusing on like like when someone comes in, I said, just focus on the calories that you are taking now to do an inventory, like see where you're at and then make slow changes. Don't change everything at once. Like don't throw out all the junk food and like suddenly eat all plant-based and then work out 5 days a week because you're not going to last. slow, consistent changes in your everyday life. Like it should be a lifestyle change. And that's when you will see progress. That's a very long answer. So I hope that makes sense. Follow me on Instagram because I always give you guys update on things that I do on there and weight updates and all that stuff. So hope that helps. Let's see. Yes, all the time. So, do you watch any medical television shows and find yourself unintentionally saying, that's not how it works? Yes, all the time. And so, Stan can never watch medical shows with me because I don't even like, I have to speak out loud. I'm just like, no, that's not what you do. And oh my God, I can't believe that's happening. And, it's pretty funny. And he will just sit there and roll his eyes at me. But I think it's really funny. Okay, more questions. I don't know what antidote about bypass. Like bypass in itself, for those of you who don't know, is where. Oh, let me pull this up for you guys. Are you talking about bypass as in the heart bypass or like gastric bypass? Because there's two different types of bypass. Let's see. Bypass. So usually, most common bypass is like bypass. When I think of bypass, I think of cabbage, which is bypass in the heart. Sometimes you have blockages in your heart or you have three vessel disease. And bypass has been shown to prolong life. What they do is they harvest a vein in your leg, the saphenous, and then they sew it to parts of the heart. I've been in multiple surgeries and watched this done, and it's just like an amazing process. And it's better to do it. Everything is worse to do in an emergency setting. And so if your cardiologist says that you really need bypass surgery, you should probably do things to set it up so that it can be a planned surgery rather than emergency surgery where your heart stops and you need bypass right away. So yeah. As for gastric bypass, there's lots of different ways to do gastric bypass. There's like the sleeve, there's the stapling, there's the Y, but basically it decreases the stomach size so that you will be in a caloric deficit and you can eat less. It's really good at weight loss, and it has helped people reverse diabetes with weight loss. But I forget what the recurrence rate is, like after bypass, how often people regain the weight. So let's see, gastric bypass surgery, weight regain. So I just Googled this real quick. Let's see. So it says about half of patients regain weight after 2 years. Average regain is about 8% after reaching low point. Total 10-year excess weight loss still over 50%. So that's actually really good. I mean, when I tell my patients about weight loss, I only recommend about, if you're able to keep off 5 to 10% of your weight loss, then that's really good. I started out at 142, 140 pounds. So really only about 7 pounds. And if I'm able to keep that off in a whole year, that has metabolic benefits and cardiovascular benefits and all other benefits. So people think that they need to lose 100 pounds to be healthy, but that's not always the case. Okay. A lot of questions about Stan. Stan is not a doctor. He is in real estate, and we met prior to med school. So he knows like nothing medicine. I think it's cool to talk to him about stuff like this, and he likes to be educated in the medical sense, but he knows nothing about medicine. So I think that there's plus and minuses for marrying someone out of medicine. The hard part is that they don't understand the struggles of going to medical school, going to residency, but being able to be there with you in your hardest times is really nice. And another perspective, kind of like right brain and left brain, it's nice to have like a different perspective in life. So yeah. Let's see. What are your opinions on the vaccine mandate? Ooh, very hot topics. So I don't think that it's actually a mandate. Like you have a choice, right? You have a choice whether or not you decide to get the vaccine or not, and understand that there are consequences to each decision that you make. I think that we should try to keep everybody as healthy and as safe as possible. And with all the studies that have come out so far, no one has died from the vaccine. And it has shown to protect you and protect others. So I don't understand really what the issue is. I think it's more like a lot of people are hesitant, and I understand that. A lot of people are very scared and nervous about something that is so politicized when it didn't have to be. And so the frustration that we feel in medicine is that we see a lot of people dying, like in Idaho right now, where they're on crisis care, where everybody is DNR right now. And as I mentioned in the beginning of this live, that DNR means that you do not resuscitate. So if your heart stops, even if you are young, 30-year-old, they will not do chest compressions. They will not intubate. And the reason why, even though you might survive, most likely will survive if you have those things, is because there's no more beds to sustain those people, everybody who is going into cardiac arrest. There's just not enough resources. Back in 2020, when we were saying like, look at Italy, look at how they are rationing care, look at how like not everybody will be saved. And we were worried that we will get to that point. And now in the United States, we are at that point, a first world country where we thought working as healthcare providers, we will have all the access to medicine we will need to save people. But we don't. We don't. And so it's very frustrating to see that because of misinformation, because of fear mongering, a lot of people are hesitant in getting a vaccine that can possibly save their life. And so it doesn't, my family is vaccinated. I'm very open about that. But it does hurt to see people who are affected by misinformation, very young and healthy people who have lost loved ones. And so I'm still here trying to convey that accurate information as kindly and empathetically as I possibly can, because we all know that guilt tripping somebody and shaming someone is not going to have them change their mind. We have to understand their fears and address those fears, and so that they feel confident in making that decision on their own. It's kind of like weight, right? If you tell somebody like, you're so fat, you should really stop eating and just move more, like that's not going to change their mind and their view on health. It's actually going to push them more towards these bad habits. And so I feel that when we shame people about a choice where they feel like this is the choice I'm making for myself and my family because of fear, we have to really meet them where they're at, because saying like, oh, you're hurting other people and blah, 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 all that stuff, like, yes, it's true. But it's not going to change anybody's minds. And so I have been able to talk and discuss with people on a one-on-one basis, like in my clinic. But it's really hard seeing so much loss right now in medicine. So yeah, do what you can. Yes. So right now, Idaho has is in crisis care, as I said. So everybody, the whole state is like on DNR. I know that sounds really crazy, but we just have no more resources. And then let's see. Okay. Let's see. This is a question. When a patient is passed away due to doctor mistakes, does a doctor down in the morgue do the body autopsy to find what was wrong with the patient? So I think this has to be okay. One, this is a very loaded question. So one, we have to understand, like, was it the doctor's mistake or not? Like, what was the cause of death? No matter what the cause, I think that if it's suddenly, the coroner will ask, or the pathologist will ask the family if they would like us to do an autopsy to figure out what is wrong or what happened that caused the patient to pass away. Everything like that is under review from the medical board, or not medical board, but there is a sort of review when something unusual happens. So say like a patient passed away, they review it to see if the doctor followed standard of care and why each decision was made. I know as a doctor specifically, when I go into any patient encounter, I have to document everything, meaning that I document talking about like their past medical history, their current history, what they presented with, all the things that led up to me seeing them now, and then my thought process, like, why did I not think it was this disease? Why did I not order this test? Why did I think this particular test was necessary? So if the doctor had good documentation of why everything was done and why everything wasn't done, or like if they come forward and say like this wrong medication was given, then we know that this is what caused patient death and whatnot. But I think it's a really long process to see why, how a person died or why a person died, versus like it was malpractice or due to neglect or bad patient care. And so as of right now, what we're seeing is that, oh, is this like, there could be a lot of things. Is this due to heart failure? Is this due to diabetes? Is this pneumonia? Is this, an exacerbation of COPD or asthma? It's like lots of different things. And so those all can contribute to death. And the person who does the autopsy can give us like, say like, oh yeah, these are the things that contribute to death. Hope that makes sense. So advice for PTSD from bullying and harassment and generally mean treatment. And so this has to be diagnosed by a healthcare professional, like a doctor or psychiatrist, or someone in behavioral health. We can have a lot of trauma in our childhood, specifically in childhood and in schools, that affect us to the core and the way that we treat people. Usually PTSD, you will have flashbacks, avoidant behavior, where you tend not to do this particular thing, avoid this thing because it causes you to have flashbacks. being scared and worried and all this stuff all the time. The first treatment usually is counseling, so like psychotherapy, exposure therapy. They call it EMDR. And then usually it's worked through with a psychologist where they help you navigate through these feelings. The next medical treatment is usually sertraline, also known as Zoloft for the brand name. It's a serotonin reuptake inhibitor as well. And those things have been shown to help with people who have PTSD, but it's a lifelong process, right? It's understanding how you react in certain ways, how life kind of like elicits this pain response in you. And so it's relearning those pain responses and basically reacting differently. And so that's really hard to do on your own. And it's easier to do with a therapist where they can help you work through those things. I think in other countries, they've tried to use psychedelics like mushrooms in order for you to relive that trauma experience, but like apart from your body, so that you can let that experience pass through you and not hold it within your memory and in your system, hence looking at it in a different light. And so if you can't do therapy, I know there's lots of stuff online right now. Like every therapist has virtual availabilities, like who's that one? But lots of people have therapists online that you can look into. I know they can be really expensive. And so things, audiobooks I find that are really good, anything from Brené Brown. She talks a lot about trauma and shame and vulnerability. All those are really good. The Pursuit, was it The Pursuit of Happiness, I believe? If you guys don't have the audiobook app, it's free. It's called Libby, where you just use I don't know, it's this one. But basically it's a app where you can listen to audiobooks through your library card. And so anything from Brené Brown, really, really good. And then The Happiness Advantage by Sean Anker, also really good. Think Like a Monk by Jay Shetty, also very good. Let's see. I like The Subtle Act of Not Giving a Fuck by Mark Manson. The Infinite Game by Simon Sinek. Those are all really good audiobook recommendations. It just helped me personally look at life from a different perspective. And I think that that's how we get through hard times, right? Because you can have a person with cancer who is the happiest go lucky person, and then you can have someone else in the same situation and severely depressed and can't do anything with their lives. And I feel like a lot of the times it's how we view our situation, and in order for us to see things in a different light and just to be happier in general. There's studies that have shown gratitude journaling, where you write down specifically 3 things, or maybe even think of them, 3 things every single day over the span of 6 to 8 weeks. You feel happier in your situation, even though nothing has changed. So for example, you have to specifically say like, I am so happy that I was able to attend this YouTube live and answer my question about blah, blah, blah. And then the next day you have to be thankful about something else or 3 other things, but it can't be the same. Like you can't just say like, oh, my husband made me happy today. You have to say like, my husband made me happy because he did the dishes and he cleaned up the house. And that made me very happy. And so doing those things every day helps you see the world in a different light, see it in a more bright and happy, optimistic light. Okay. Hope that makes sense. The app is, so Melissa, the app is called Libby, Libby, and it looks like this. This one. I don't know if you can see that. Let me pull it up. Libby. Okay. So this is what the app looks like. On your phone, it should look like this. And literally changed my life. I've been listening to so many audiobooks. The only thing is that some of the audiobooks you have to wait, where it's like a few weeks, but then I just like put a whole bunch on the wait list, and then anytime they come, then I start listening to them. The one that I just finished, let's see. I don't know how to show like, oh, my previous books. Yeah, so then right now I'm listening to The Power of Attachment by Diane Pohl Heller, PhD. And then I just listened to The Power of Vulnerability by Brené Brown. But yeah, so those are really good. Oops. Hi. Okay. Let's see. Any other questions? Yeah, a lot of people confuse me for her. I mean, I think she's Vietnamese too. She might be Vietnamese. We might be the same ethnicity, but she's a lot older than I am. So I think I look younger than her, but I'm biased, obviously. Okay. Any other questions for me? Do you like being a mom? Being a mom is all very beautiful and very frustrating. It is probably the hardest, most humbling thing that I have ever done in my life. So I was not ready to be a mom, to be honest. Like, my body changed really, really fast. I wasn't very skinny, but I was slender, right? I had thick thighs and I still had some chub, but I was smaller, right? I wasn't ever overweight. And so when I got pregnant with Wyatt, I had 70, I was 170. So I gained like 50 pounds. Yeah, because I was 128 and then I was 178. So I was almost 180 and I had gained 50 pounds. I had stretch marks all over my body and I was just not used to being pregnant. And when I was in med school, I wasn't ready to share it with the world. I didn't share it on social media. And so I felt like a lot of the times I was like hiding my pregnancy. So I never really got to enjoy like the whole pregnancy glow and being so happy about being pregnant. Like, I see other moms now and I'm just like, oh my gosh, you look so beautiful. And I'm so happy for you. And I'm a little sad that I didn't get to process and experience that. And so afterwards, when I delivered Wyatt, I had really bad postpartum depression. And so I did not see clearly. I was like always sad. I was always tired. I was easily frustrated, easily angered. I had little joy in doing things. Like, I love YouTube. I love making videos. And at one point, like I didn't even enjoy doing that anymore. So the things that used to bring me joy wasn't making me happy anymore. And I didn't even realize that I was depressed until afterwards, like when it was over. And then my second pregnancy with London, it was a lot better. Like, I was a lot happier, but at the same time, it was just like still really hard process. And so if you feel anything like that, please like talk to your doctor about it. Like, a lot of people are in denial and they like mental health is a stigma, but I really feel that I needed help and I was just not willing to admit that I needed help. And then being a mom has really made me try to be a better person and work on myself. I understand that I have a lot of childhood trauma. My parents were supposed to get a divorce. Well, actually, they divorced when I was 5, remarried each other, and then divorced again when I was in like 7th grade. And so constantly fighting in my household all the time. Like it was very, very toxic. And so I have this internal struggle about like who I am and, you know, constantly feeling shame or being not good enough. And if you don't check those things as an adult, I feel like you kind of portray that onto your children. And so it's really hard. And that's why I feel like I've done so much more for my own mental health over this past few years that helped me not only be a happier and healthier person, but being that person for my children, because I don't want them to grow up in something like that. I found out recently that I'm an empath. I don't know if you guys have heard of that before. I talked a little bit about it on my Instagram stories, but basically empaths are people who are able to experience or feel your emotions or somebody else's emotions when they're in the same room. So most of the time when I walk into a patient room, I can tell if they're anxious, if they're nervous, if they're sad, if they're trusting, or if they're withdrawn. Like I can feel those things. And I was always thought that I had like really good body language cues, like I could pick up on those things, but I feel them with like viscerally. And usually empaths come from like traumatic backgrounds, as I said, more of like a defense mechanism. Because when my mom was angry, like she was angry at everything, including her children or anything that got in her way. And so it's more of like a protective thing, like going into a situation. Are you going to be safe? Are you going to be welcomed? Or is this time to just sit back and withdraw and kind of not say anything, kind of disappear, you know? And so I realized this when the other day I had very sad patients who had lost loved ones. And I see the whole family. I see the mom who just recently lost her partner, and then I see the children, and all of them are crying. And then I came home and I just like stuffed my face. Like I literally wanted to eat everything, and I wanted to eat to the point of discomfort, even though I wasn't hungry, because I was trying to fill like a void within myself. And then I realized that I was like emotionally eating and all that. And so I started looking more into like this whole empath thing and realized that that's who I am. And I don't want to project that onto my children. I don't want to traumatize them. I don't want to ever scream at them when it's not their fault, understanding that they're little humans and they're exploring the world for the first time, and being patient with that. It's a hard thing to do. It's super, super hard. So yeah. Let's see. How many days? So question, how many days, weeks in advance did you study for tests, quizzes, in med school? I honestly feel that med school, you're constantly getting tested. Like every week we had a test, and every month we had a test. And so there was really no downtime for me to be like, oh, I'm not going to study today. Like every day I had some sort of studying. If you guys have not started Anki as of yet, like start it. It's research have shown that that is how you learn things long term. It's not necessarily intake of information, but how you retrieve the information from your brain. So answering test questions, or answering questions from your friends, or if they constantly test you and things like that. And how often you are able to remember those things. It's what will put it into concrete and long-term memory. So I know people can cram, but that's just not me. I have never been able to cram. And so I would always be like constantly trying to learn and relearn and teach others, and so that I can, remember things from med school. And that's why I like doing Medical Mondays, because then you guys ask about like thyroid or like vagus nerve or something like that. And I'm just like, oh yeah, I need to refresh my memory. And so like, I'm learning with you. So it's pretty awesome. Do you recommend taking a gap year, any gap years in medical school? I think that this is, I personally did not take any gap years while I was in medical school. But I think that the system, how it is currently created, does not really allow for that. And it's horrible, because medical school is 4 years and residency is 3 to 4 years. And then, or 3, 4 and above 7+ years. And then fellowship is 1, 2, 3 years or more. And so it doesn't really give room for you to have like fertility. And so people tend to put it off for so long. Right now, if you take a gap year during med school and residency, they're going to ask you, why did you take a gap year? Did you do extra research? Did you do anything that gives you an advantage for residency? It might be harder for you to get into residency because of those things. And then while you're in residency, if you take too long applying for your fellowship, most of the fellowships want you to apply at least 1 to 2 years after you finish residency. So it's really hard to like take a break. Not saying that you shouldn't. I think that it should be more normalized, because people live lives, people have lives to live. And so that culture is just not there. And so I don't know. I feel like people in medicine have to constantly try to change it. Like, I'm trying to normalize and talk about starting children in medical training. Like, it should be normal, but then again, it's looked down upon. And then you, as the person who's carrying out the pregnancy, try to compensate by doing more and neglecting your own health, neglecting like how much time off you have in order to just graduate in time. But I think that culture is very toxic, and I don't know how to change it besides talking about it more. Mitch, hello. For a person that doesn't drink, how do you correct fatty liver? Diet, exercise? And so fatty liver in itself, there's multiple types of liver disease, right? So you can have hepatitis or some sort of infection that causes the liver to have necrosis, which is just hardening of the liver. This is very dangerous because there's lots of different vessels that run through the liver. Liver anatomy. Let me see if I can show you. See, so this is the liver, and there's lots of different vessels. This one goes back into the heart. And so once it is hardened, you can see that you can have pooling and then hypertension and all this other bad stuff that can happen. So many things go through the liver. And most of the time, if it's not an infection, like not hepatitis, and it's not your alcohol intake, like you're not drinking excessively over, I would say, 2 drinks a day for extended periods of time, other things are fat, basically. So cholesterol, fats that deposit into the liver that can cause it to have dysfunction and inflammation, elevated liver enzymes. This is actually the most common that I see in the outpatient basis. And so what I start recommending for my patients is the only way to get rid of that fat in there is with diet and exercise. Losing about 5% of your body weight currently can help with those things. Sometimes they say metformin can help with that too. We don't understand the pathophysiology or how it works actually, but we know it's in the liver, helping with glycogen stores and insulin sensitivity. So that can help. But I've seen people talk about, like apple cider vinegar and all those other things. Studies haven't shown that they work. And so work on that diet and exercise specifically for weight loss, 5%. Okay. Let's see, lots of other questions. So many. Okay. There's a question. I'm having a hard time understanding and enjoying biochemistry. I'm also a pre-med biochem major. Do you think that I should reconsider becoming a doctor? I would say no, depending on your reasonings of why you want to become a doctor. For those who aren't really sure, I highly recommend at least shadowing a physician to see like, what is it really like to be a doctor? I remember in med school, like I didn't really know because I was part of Clinical Career Extenders, which is a volunteer group where you go into the hospital to take care of patients and things like that. So you're with the nurses, you're with the CMAs and things like that, and you see the patient care aspect, but you don't really see what the doctor does and you don't see what their schedule is like. And so when I was rotating there and helping with patients and stuff like that, I'm just like, why don't I be a nurse? Like the nurse is doing the majority of the work. They're with the patient all day and the doctor comes for like 15 minutes and then they're gone. And so I didn't really understand it until I actually shadowed a physician and was there, behind the scenes and learning the medicine aspect of it. And so I was a biochem bio major, and I mean, like, I don't know anything else because I don't know if I enjoyed like different aspects. Like, I don't know if I'll enjoy engineering or architecture or like any other field. It's just like medicine is all I've ever known. And I really do enjoy like patient care. I really do enjoy learning the disease process of things and how things work. And so I really think that you need to ask yourself, like, is it just the subject topic that's not interesting? But eventually that will be a very small portion of it. Like, I don't know, like, I can't probably tell you when the last time I used the Krebs cycle or like used the OChem equation, but I had to learn all those basic sciences to get into med school. I'm more interested about like how the body works, how physiology works, or like how disease process works, how it progresses, how do you get better? I'm also interested in like mental health and like why people think a certain way and, happiness and all that stuff. And so I wouldn't say that you should just give up because you're not enjoying it, but understand like why you're not enjoying it, basically. I always tell people, like, if you haven't already, try to be a scribe, because then you get to work directly with the doctor, you get to learn medicine, and you see what their role is like, you see kind of what they have to do in the whole doctor role and their schedules. And so you see if that is the right life for you. And then I feel like it'll also give you a heads up if you get into medical school. So more exposure to see if you like it or not. Let's see. Okay, Anki. Back to Anki and doing test questions. So for those of you who don't know, Anki is kind of like a system where you can input your own notes and test yourself over time. If you get an answer correct, then say they'll put it in the next deck where they'll ask you the next day. If the next day you get it correct, then they'll ask you in a few days. In a few days, if you still answer that question correct, they'll ask you in a week, in a month, and so on and so forth. But basically, it helps you like get that information again, retrieve it from your brain. As I said, it's not the amount of times you read through a paragraph and obtain information. It is how many times you are able to retrieve that information from your brain to get it out of there. And so that's why we say do test questions, because when you do test questions, you are actively trying to pull information from the crevices of your brain onto that paper. And so with Anki, it's a system where it's scientifically proven to help you commit short-term to long-term memory. And so with Anki, you can either make your own cards, or you can purchase cards that are already made for you. So there's like step 1 and step 2, I believe, that are already made. And then I know there's MCAT ones that are already made too. And so I didn't fully get into it until later on, and I thought it was too late, but I just did a whole bunch of like test questions when I was studying for boards. Like I think I did close to 10,000 step questions before I took step 1. But I wish I had Anki because I feel like I would have done so much better. Do I make my own cards and use decks that are online? You could try using the online ones, especially the ones that are already catered towards step 1 and step 2. And I would start early, like just putting all your, like if you're making notes, like, and you think something is important, just put it into your Anki deck and then go through it over time. I think it's really important when you get to second year, because second year is when you start doing your system-based learning. So start doing it early. But it's only been the second week, and so you're doing great. Just take your time, study, and then work in groups and all that stuff. Remember that it's more collaborative, and so don't be too hard on yourself. While being a student, were you good at anatomy and physiology? I think learning anatomy is like learning a new language. Yes, anatomy can be very hard, and it is like learning a new language because a lot of the anatomy parts and that they name are in Latin. And so it can be very hard. For me specifically, I am a very visual learner. So anatomy lab was very helpful. I also drew a lot of my anatomy things. Like the hardest one for me was like different muscles in the arm, in the extender side and this flexor side, just because there's like 5 or 4 muscles that go over here that all look the same. And then there's muscles over here that all look the same, attaching to hands, which have lots of different bones in them. So probably the hand and the arm were the hardest for me, but bigger muscles and thinking of them in layers was easier for me to learn, especially when you're in anatomy lab and you're like going through the different layers, it gets a lot easier. Physiology, it was a hit or miss in the beginning. It's kind of like OChem for me. I love learning things that make sense. So like if I can reason through things, kind of like math, but only algebra. Kind of like algebra, where you're like, do this and this and this because these are the rules, and then it works out that way. But it just, honestly, it takes time. I still use a lot of anatomy, especially being an osteopathic physician and doing OMT. And physiology, I feel like I do that a lot as well, just like understanding why medicine works and trying to explain that to patients. So yeah, just takes time. Consistency and time, just like everything else in life. Oh my gosh, this is so nice. sorry, I'm just reading through this. Hi, Jenny. I started following you when I was an MS4 medical student, fourth year, when I was looking into other women with children in medicine. Now I'm a mom of two and in my third year of internal medicine residency. Oh my gosh, that is so amazing. And in your third year, you were almost done. I am so proud of you. And that is so awesome, especially for my internal medicine colleagues. Like our program had both IM and FM. And so our FM program was a lot friendlier and our schedules were a lot better. My co-resident also had a baby, two babies in residency. I had London in residency and Wyatt just before starting residency. And one of my other co-residents, a guy, had a baby in residency too. And it's just so nice. While internal medicine, they're all like, no, I had to wait. I can't get pregnant right now. So it was a lot harder for them. But I think it's more of like the skepticism and just the culture of medicine where nobody wants you to get pregnant because you work less and whatnot, but it's not true. So yeah, I'm glad we're setting examples for the future generation and letting people know that it's okay to start your family while in medical training. And it should be more common, I would say. Okay, let's do one more question and then call it a day. And I know I'm doing this so early, but I have a really hard time staying up late. I know you guys are all night owls, but it's really, really hard for me to sleep. I mean, go to sleep late. Let's see. Let me run through this to see if there is anything else that I can ask. Okay, last question here. Let's say, looking back, in your opinion, was med school really hard? I think hindsight is really 2020. There's a lot of things that I would probably have done differently, as in not be as anxious as I was all the time. Wish I started Anki earlier. I wish that I had a more collaborative view on medicine where I would, studied in groups more and find somebody to test me and ask me questions. But I was more of a loner. Like I lived by myself, and only got together with my friends to go eat and stuff like that. So I wish that I did more studying groups. And if I could, I wish maybe I could have tried to live with roommates in medical school. I was just so nervous because I was just like, I had a really bad experience when I was in college living with roommates. My first and second year of just college, like they were really mean, they didn't help out, and it just added to a lot of the stress of college. And so I decided that, I'd rather just have my own space and study on my own. And so going back, I wish I had more of that support system. But med school is going to be very hard. It was like studying for the MCAT every single day, but it doesn't have to be draining. Like I enjoyed the subjects. I think studying smarter rather than harder is the key. So learning how to very quickly obtain the information and studying it afterwards. And then if you're tired, understanding when you should stop, because just because you're sitting there in the library or just because you're sitting there trying to study and nothing's getting through your head doesn't mean that the longer you stay there, the better things will get. And so some of the times it's better to stop and take a break, rejuvenate, and then come back to it. So yeah, I would say it's one of the harder things that I've done in my life. Residency was probably harder for different reasons. Momhood is probably the hardest, but it's a constant learning process. And I think that anybody who is willing to put in the work and willing to study and sacrifice a little bit can make it in medical school with the proper resources and support group. So yeah, don't give up on it if it is your dream. I still think that being a doctor is incredibly satisfying, and it brings me so much joy to be able to be that part in everybody's lives and to be that support system, to be just to have advice and to make connections with other people. Like it's a very humbling experience that I don't think that I would have gotten anywhere else. Obviously in other parts of medicine, but I'm very happy with being a doctor and having autonomy and doing procedures, and I don't know, just everything about being a doctor. It makes me so happy. Yeah, it makes me a better mom, and being a mom makes me a better doctor. So it goes both ways. But yeah, okay. All right, everybody. Thank you guys all so much for being here with me today. I'm still trying to figure out what the best time frame it is for these Medical Mondays. Like, I love talking to you. I love that there's such a robust conversation going on in the side. And it seriously makes me so happy to be here with you all and just talk and connect with you. It really gives like that more personal connection. Let me know if there's anything else you guys want me to talk about in kind of like the comment section down below, and I'll talk about it. I'm going to try to start making videos about different health topics, as I told you about, like hypothyroidism, fatigue, fibromyalgia, chronic pain, back pain, IBS, and all these other different medical topics. And so if that interests you, just leave your questions down below, and I will do my best to answer all of them. Thank you guys all so much for watching, and I'll see you guys again next week. Bye.